Welcome to first semester, Unit 4, RETT syndrome, or it is also called as X-linked dominant traits. It was first found by Dr. Andreas RETT, Australian physician, who first discovered it in article in 1966. This RETT syndrome is a neurodevelopment disorder normally affecting the girls. Most often it is misdiagnosed as autism or cerebral palsy, but RETT syndrome causes the problem with a child's motor skills affecting the use of their hands, walking, eating and breathing. So this RETT syndrome strikes all racial and ethnic groups and occur worldwide in 1 of every 10,000 female births. And this is also a genetic disorder that occurs when there is a mutation in MECP2 gene on the X chromosomes. MECP2 gene means methyl CpG binding protein, and this occurs on X chromosomes, and this gene, it provides the instructions for making protein for the normal brain development, and it forms the connection between the nerve cells where the cell to cell communication occurs. And this RETT syndrome disturbs the gene process in creating building blocks for the brain. So this is the location of MECP2 genes on the chromosomes, and that is also on the X chromosomes. So it always occurs as new mutations with less than 1% of cases being inherited from a person's parents, and it occurs almost exclusively in girls, and boys have similar mutations typically die shortly after birth. So the diagnosis is based on the symptoms and it can be confirmed with the genetic testing. So why does RETT syndrome mostly affects the girls and but not the boys? So XX chromosomes, that is found in females, and XY chromosomes, that is found in males. And this MECP2 is present on the X chromosomes. So they have a backup on X chromosomes, and if there is severity determined by the amount of expression of the gene MECP2, it is turned off or in the cells, so there is no backup X chromosomes. So this disease will be more destructive and severe as a result. The signs immediately after birth and no clinical symptoms, and this person, the child, often dies shortly and only a small amount live past birth. So there are different stages where this RETT syndrome affects. It occurs in 4 stages: stage 1, stage 2, stage 3 and stage 4. And the earliest symptoms that occur in stage 1 is the early onset, that is usually begins between 6 and 18 months. And you can see here the infants, they show less eye contact and delay in motor skills. You can see here there is a rare neurological disorder in the young girls, and there is an impairment in ability to talk, in walking, in eating and in breathing. And there is a repetitive hand movements and flapping and clasping hands, and as I told you, it was discovered by Andreas RETT, so it is called RETT syndrome. And this will tell the stages of RETT syndrome. The stages which occur between 6 months to 1 year, there is an early onset. Here you can see there is a decreased head growth, hypnotonia, that is delays in gross motor skills, then loss of hand skills, a loss of speech, less eye contact, social interactions, and interest in toys. So this is the first stage, that is early onset of Rett syndrome. And in the second stage, there is a rapid destructive, and which occur between 2 to 5 years. There is autistic features, intellectual disability, decreased head growth, more apparent respiratory abnormalities, then hand stereotypes, motor dysfunctions you can see in the child who is affecting with Rett syndrome. This is the second stage. And in the third stage, the plateau, the seizures are usually prominent, autonomic dysfunctions, behavior may improve and increased eye contact, and then hand use. Many people with Rett syndrome remain in this stage for entirely of their lives. This is the stage 3, and in the stage 4, that is between 10 to 20 years, there is a late motor deteriorations. So there is a decrease or loss of mobility you can see in case of this child affecting with Rett syndrome. And there is a dystonia, that is spasticity, and communication, hand skills generally stable, and also scoliosis. These are the stages of the different stages of the child who is suffering with Rett syndromes. As I told you in the previous slide, the stage 2, there is rapid destructive begins at ages 1 and 4, begin to lose the ability to speak. Then that is what is called as chorea. Then spasmodic chorea, the spasmodic movements of hands or facial movements of hands or facial muscles, and they also breathe abnormally, and crying and screaming without provocations. So this is what is called as this is what occurs in stage 2. And also the microcephaly, that is abnormal microcephaly, that is small heads. This is the stage 2. And in stage 3, which occurs between 2 to 10 years old, that is called a pseudo stationary stage, there is the problems with the mobility continue. However, the behavior begins to improve, which includes less crying, become more alert, improved attention span, non-verbal communication skills, and this is the plateau stage. And many who are affected with Rett stage in this stage for the rest of their lives. So the girls and women in this stage can learn about new people, things, and situations. And the fourth stage is the late motor stages, which last for years to decades, will reduce the mobility with curvature in spine and muscle weakness, and which can cause someone who was walking to not to be able to walk, which varies according to the ages. Scoliosis, that means the abnormal curvature of the spine. Hyptonia, that is weakness of the muscles, decreased mobility because of the weakness of the muscles. Bruising, that is grinding of the teeth. Ataxia, that is involuntary movement. Epileptic seizures, and dystonia, that is repetitive movement. These are the different stages of Rett syndrome. And that along with the abnormality, that is syndrome, which is found in different stages, that is stage 1, stage 2, stage 3, stage 4, etc. Along with the neurological disorder, there is also impairment in the metabolic component. What is the impairment in the metabolic component is the abnormalities in neurometabolites, then altered carbohydrate metabolism, increased pyruvate and lactate in CSF, then elevated lipids, then reduced choline phospholipid turnover, then oxidative changes occur in the brain. And also the liver, there is an inflammation of the gallbladder and elevated triglycerides, that is fatty liver. Then adipose tissue, there is an abnormal glucose tolerant tests, insulin resistance. And then serum, it is increased cholesterol, triglycerides and LDLs, and there is an increase in leptin, pyruvate and lactate, and there is a reduced ghrelin and elevated ammonia. And then in mitochondria, there is an abnormal mitochondrial structures, then altered electron transport chain functions and increased oxidative stress. Along with the different stages of neurological disorder, there is also impairment in metabolic components, which is the person who is affected with Rett syndrome. So how it is the Rett syndrome is diagnosed? It can be diagnosed by genetic testing, the clinical diagnosis looking for the abnormal signs and behavior, and looking for a period of normal growth and then a gradual regression of development, the muscular atrophy, the EEG abnormalities, the epileptic seizures, scoliosis, and the repetitive hand movements and breathing abnormalities. These are the diagnostic tests to detect the Rett syndrome. And the main cause of Rett syndrome, the main feature in which causes Rett syndrome is apraxia, that is inability to perform motor function, because it is it affects the nervous system and it interferes with every movement in the body, and it is most fundamental and severely handicapping aspects of Rett syndrome. So women with Rett syndrome often show a autistic behavior, that is apraxia of speech. That is, in case of apraxia of speech, the affected person or the child finds it difficult or almost impossible to initiate speech, as she is unable to move the mouth and tongue to speak. This is the main cause of Rett syndrome. And is there any cure for Rett syndrome? Of course, there is a cure for Rett syndrome, but there is a treatment. The treatment for Rett syndrome is symptomatic, focusing on management of the symptoms, and a supportive requiring a multidisciplinary. So in conclusion, Rett syndrome is not a deadly disease, but it can shorten the lifespan. So these are the references. You can refer these books for further information. Thank you.